Katata Curve, ka trendsetter SUV ke bawandar kalapoy ha Shillong. Wan ban test drive ka coupe SUV ban ninggong ekari ane pila ban phone ni number bala ai harum.
Jingiakynthuh ka basisni Jong ka Thaiñ lam Mihngi Jong India ka Blapalong da ka Meghalaya State Rural Livelihood Society MSRLS ringkat ka The Nudge Institute Bangalore ha ka afnyo trek mataw na ha Shillong ka phang Jong ni ka Jingiakynthuh ka long ban pin Thaiñ ya ka Mariang bat ki kinja ki ba em kham tam ukun ban rio baro hapo Jong ka ki ba la Shatei Jingmut ka long ban lum ya ka kinhun prepare ban wad ya kilat kelenti ban punroi ban yada ya ki bri ki bala sha nyo ben badan ha ni ka Thaiñ city lam Mihngi Jong ka India ha ka jingkran ha ni ka Jingiakynthuh umentri badai pek ya ka tanat sianadi u iti mondal la ong ba ki don chibun ki lat ki tabu ya ki nampandong bat ula ai nuksa ba ka snong kweng hapo ribhoi district ha ka ba ka Thaiñ da ka saptrai ka jongki bat kalayate parlok bat ka Usha International Limited ban penmi bun ula kren ru halor ka jingdon kam jongki self help group niki SHG Jingiakynthuh ka bala kiu bha manta nadu usnem arajar khatphra hagani ka program la yoru ya ka jingkren na u Charanjit Singh IFS Additional Secretary ka Ministry of Rural Development jong sarkar India haga jinga donlang jong u B Rajsekhar IAS Special Chief Secretary jong sarkar Andhra Pradesh Sampat Kumar IAS Development Commissioner and Principal Secretary jong sarkar Meghalaya bat kumju kidong mikmat jong NRLM na ki Jylla Assam Tripura Manipur Bihar ba Jharkhand la yoru ya ga jingya phliu Jingmut na ki ba wani simbentalang na ki kinhon ki ba pher
And I just thought I'll run through because this is the kind of planning that is required. This we have done 13 years back. Wage employment for Narega, how much is the expected rise in income? Sustainable agriculture, premium from collective marketing, dairy, livestock, income from...
We got a very good, setting for this conclave, especially the purpose of conclave is essentially how we can come up with better strategies and a more shared purpose to really include the most excluded. So I think the topic that given to me and which I'm going to talk about is what is the role of CBOs in human development. So I just wanted to use this approach. Essentially the Meghalaya's vision for human development. So we have been working for quite some time. I would say we just started this journey before the COVID, and we have something to share, like how actually we have been working on this particular idea. So this is the outline that I would like to share. Then just like to give you the context to I think a lot of people from Northeast would appreciate. If you see the Meghalaya, we have about 6,600 villages. And if you put the urban localities, total put together 7,000, communities and localities. You can actually gain 40 grams every day through exclusive and effective breastfeeding, 40 grams per day. So stunting problem can be effectively reduced. In fact, we are working with IIT Bombay on this. So, but just like the Nutri Gardens and some. So, just this something that I want to tell you. The village employment councils. In fact, in Meghalaya, though we are a matrilineal society, women are not involved in the governance structures. Traditional governance structures. But through village employment councils, we brought a policy during this COVID period, 2021. And from 300 and, there used to be only 326 women functionaries in the village employment councils. And from there, I think it has gone to 4,624 in no time with women. So the policy is very interesting policy here. In alternate elections, only women can contest. In alternate elections, only women can contest. So that actually is a very interesting thing. So it's a beautiful way, in fact, this is happening. So there's investing on women. In fact, today the core topic, this entire thing is about how to mobilize, use this entire women's based or women's economic collectives to bring that transformative development, to bring that inclusive development. So women are really key. So we're trying to bring such kind of a policy support, affirmative action, and and bringing this entire approach and designing, which is this a kind of a human development pyramid, essentially using that research, science, and the community mobilization.
So JSLPS, our state SRLM, has designed a kind of a combine and also the composite UIF activities to targeting the vulnerable sections actually. So one part was with us like the PVTGs, so who are the most vulnerable sections from the tribals. There are also the other part where now currently we are having that opposite, the ultra poor graduation approach in Jharkhand, where now we are here and we are planning to 50,000 such households going to be Meghalaya, including, which is a real, it would be a great achievement for the state, for the most excluded. So like also in Jharkhand, we have started the partnership with our Nudge Institute. And also we have a other segment of the women who are the most vulnerable sections, especially from the tribal communities who are forcefully, they don't have any kind of resources, they don't have any other means of the livelihoods, so they are forcefully selling the country liquor at the roadside. So they are also having a very different kind of vulnerabilities. So that's also another segment of area where actually we have started the interventions from last 3-4 years. And all these interventions actually, because it's not that state government or state has, it's not realizing that there is the vulnerabilities and we have to do something. But there is a need of the partnership, because obviously my topic is in the partnership collaborations and how we have achieved this and how to scale it up. So now we have moved from that I to the we part actually. So always from the government perspective, we are thinking that, so we have the resources and we have, so because we are from the government side, we can do everything. But that's the wrong concept actually. So from my learning and from last 7 and 8 years of whatever we have implemented, started, because we need the good people, we need the kind of good institutions, good organizations to be with us, and that collaborative approach is also required. So like at the initial session, Sampal sir has also already mentioned, because so sometimes we are stuck with ourselves because we know everything and we can't do everything from the government perspective. It's not. Because we need the diversification, we need that talent, we need that technology to actually to reach out to the most vulnerables. So that approach we have adapted, and from last 5, 6, 7 years actually we have started this journey. Just below, so we have our partnership approaches and the partners. But also there are many more, but particularly for this section, for these most excluded, most vulnerable, so we have started the partnership with the Nudge Institute. So now Nudge is, we have the plan with the targeting to the 1.5 lakhs most vulnerable sections to address their vulnerability in the Jharkhand. Almost we have covered around 70,000 households with that. So we have the dedicated programs for the PVTGs, which are the UDAN. So we have started from 2019-20. So we are covering around 24,000 particularly vulnerable tribal groups, the same graduating approach model actually. So with that social inclusion to addressing their vulnerabilities, to how to access their basic rights and entitlements from the government schemes, how to plan their livelihoods, which are the diversified livelihood programs should be, like Jaranjit sir also mentioned. It should not be a kind of a one livelihood options, it should be like 2, 3, 4 livelihood options, so that the livelihood diversification, how it would be with the most vulnerable sections. And also to address the other parts of the life, other parts of the development, like already sir has mentioned, so like the health, nutrition and education also. So these are the broad aspects actually under that UDAN project, which are targeting for the particularly vulnerable tribal groups. That's a special intervention we have started with the support from our Minister of Rural Development and the government of Jharkhand. So, and then also we have developed a proposal, developed a kind of dedicated program which is called as the BVJVY, which is the Birsa Bishist Janjati Vikas Yojana, which is targeting for the entire whole 75,000 PVTG households in the state, majorly targeting to their addressing the livelihood aspects and the other aspects of their, especially the nutrition and the education and the health. So here also the Nudge Institute is supporting now. So now out of the 75,000, from last couple of years we have covered around 10,000 households with the same graduating approach models. Then we have the Fulojan Ashirwad Abhiyan, which is already I have mentioned that the vulnerable women who are actually forcefully, they have to sell the country liquor at the roadside, and who are actually so undignified, they are having with their undignified life. So in that approach, we have identified, currently we have identified 36,000 plus vulnerable women. So from, and especially out of them are 87% are from our tribal groups. So we have identified them, we have including into our SSGs fold and into the same graduating approach from the livelihood diversifications, from the rights and entitlements, from the health, nutrition, other women issues, so other social issues that also we are addressing. Where, so thanks to our Nudge Institute, they are also supporting around it.
I stand here to deliver something about the ultra-poor graduation approach and the community interventions there. Bihar, as you know, one of the poorest states of India, has committed to ultra-poor program very early, and what other states are doing now, we started in 2018. And we are proud to say that we are leading the world's largest government-led ultra-poor program, Satat Jiyukoparjan scheme. So I will start this will be a journey through why this ultra-poor poverty eradication program was initiated in the state of Bihar, what has been our model, what has been the impact, and what we now try to, how do we now to raise the bar so that the achievements in this field are not dissipated by certain shocks that the ultra-poor family go through. It's a unique program, as you know, that it was launched in 2018 in collaboration and with the Bandhan Konagar, who were the pioneers in this ultra-poor graduation schemes. And the government of Bihar has actually partnered with other institutions like JPAL, BRAC International also in this journey. See the initial challenge, why this program was conceived in the state. When we look at the SCCC data, the D3, the deprivation data clearly showed that there were 0.52 million people were rural households, were women-led deprived sections. We didn't had any knowledge how to handle those poor people which didn't had any male member actually helping them or leading them. The NFHS 4 data also showed that the poverty, multidimensional poverty in Bihar was around 51%, 52%. And this itself gave us a challenge how to address this. So the next question was that, now why ultra-poverty was focused here? We have been engaging in the World Bank since 2007. Our 10-year engagement with the World Bank, the precursor to NRLM, the BRLP project. In the BRLP project, the findings were very clear. Despite we were able to achieve the social inclusion to 80%, still 20% of population was not served. They were not part of some SHGs. The reasons were very clear. People were not confident about what were the benefits of the SHG movement. They were not aware of the SHG. They didn't had money to even of 10 rupees per week to save for SHG.
Opening remarks from you, sir, on what are some of the successful examples of effective working partnerships that you have seen in your regime, and what does it take for a genuine partnership to deliver results? Any examples from your past will be very useful for this audience to understand.
Thank you very much. So I wouldn't take much time. I think you listened to Bihar only. That was a very wonderful presentation. The more I learn about Jivika, the more I'm impressed. So I have heard them so many times, but again and again I'm impressed. So you should see the context in which the Jivika has functioned. So Bihar used to be considered one of the poorest states. Resource is a problem, but even then, so with the help of so many partners, I think they have given such a good model which not only the country, from world over, different countries are coming over and seeing this. So I think this shows that if we partner and our heart is in the right place and we take a commitment, I think we can make a success. That will be my comment in very brief.
Thank you, sir. I think intent to partner meaningfully perhaps precedes everything else. Sampath sir, some opening remarks from you on that. If you could probably specifically touch upon, we spoke a lot of things that are successful, various examples from Jharkhand, Bihar, and from Andhra as well. But two things. One, when we look at scaling solutions, what are some of the things that we should be wary of, that these things can go wrong, and therefore prepare in advance?
So in that, what the SAGs of SRLM have done is wonderful. That even the officials from the state level, even the Honorable CM and his team, they didn't expect that SAGs can come to that level and help the people over there. So few initiatives I'll just try to highlight. Number one, just before the intervention was made through the government officials and other initiatives, the SAG members and the CLF leaders who are nearby the relief camps, they give every possible support to the people in the camps. So be it food, be it mental counseling, or be it vulnerable people, like help to the pregnant ladies or the ill people. So the first and foremost help was got from these ladies, whether it be SAGs or not. So there was wonderful, and most of the things were done in the areas where SAGs were in great number. So that is one. And next thing, which even I didn't expect, was these SAGs women, with the help of the local ASHA workers as well as the Gaudi workers, they calculate the nutritional needs of the people, especially for the vulnerable groups, because the food that was given to the relief camps was very basic, and it really was meant for the youths or the adults.